me for this podcast.
Thank you for having me.
I'm really excited today.
Me too.
Okay, so I think we should start by introduction. So would you mind introducing yourself?
Yeah. My name is Holly Annand. I am a licensed practical nurse, and we have worked together for here and there a year or so now with the group home, and I'm just a lady who lives at home with her cat.
That was a good introduction.
Thank you.
Okay, so let's start with some serious questions. Like
Sounds
not
so
serious,
good.
serious.
I'm
but-
ready to get deep.
Okay, awesome. So, growing up in Canada, what you think frontline work was versus now you are a worker yourself, so how do you find the reality about the job?
I mean, frontline work wasn't like a concept for me until I started university, and that's when I kind of looked at it from a lens of I want to be able to help people who are facing crisis, who are going through diverse health needs, diverse social needs, but it didn't really come up growing up because it was I feel in Canada like we are very privileged and very very fortunate to maybe not, I didn't see it as much when I was a kid. I mean, certainly now we see a lot of people who are accessing services where frontline workers are the pinnacle. It really just didn't show up a whole lot. Yeah, and I mean that totally shows the privilege I had growing up, but it didn't show up a whole lot.
Yeah, because I also feel that the mental health awareness also like is increasing since recent years because I don't remember anything like that when I was a kid too. So
No, we didn't have like mental health initiatives. It wasn't talked about.
yeah, that's right. So what made you decide that you want to be a nurse? Like,
Whew. Okay, right to the nitty gritty. I love it. I had a really adverse, traumatic childhood experience. My dad passed when I was 7, and that was kind of like the center point of I want to be in a profession that helps people. And at first, I didn't really know what that was going to look like for me. When I was about 15, I was like, maybe I could try nursing. And then I kind of psyched myself out, sold myself short. And then when I started working in frontline social services, it was the lack of healthcare that people who use drugs or people who have mental health disorders are seeing, especially in Nova Scotia. I wanted to be part of like bridging that gap and like having that basic understanding that lots and lots of people in healthcare do, and you don't enter healthcare without having some sort of empathy for others. It really, like, from a social service work standpoint, came from an interaction I had with a client who went in for a sexual assault exam. And I sat there with this client while they had the exam. And I was like, this is something that I could very well see myself doing because it's a combination of both. But like it came from a lot of like my own experiences and then meeting so many people who are chronically unhoused, having substance use disorders, stuff like that, and seeing that healthcare disparity.
okay, yeah, it's a good decision.
Plus I like staying up all night.
That was actually a question, like, do you prefer day or night shift? So
Night shift.
I think I clearly get the answer.
Oh.
So, how hard is it to get in nursing school? Like, is it competitive?
It is competitive. The pathway that I took through NSCC, some of their campuses are seeing like a 4-year waiting list.
4 years?
4 years. I have a good friend. I think she sat on the wait list for 3 years for their blended program. So all of the theory stuff is self-directed online.
Okay.
She goes to the campus for like the skills and like the lab portion, and then she's out in the hospitals for the clinical portion, which is really similar to what I did, but all of my theory portion was online but taught by instructors on like Microsoft Teams.
Okay.
The RN programs are a lot more competitive, a lot more expensive. That's kind of why I chose the LPN route. But the competition is definitely there.
Yeah.
Getting into nursing school, there are a lot of seats in a lot of different programs. I found like my graduating class, I don't know how many we started with, probably close to 40. We graduated in the high 20s. So some people find out it's not for them. Some people, they move on to different things.
But it's actually crazy. Like, people can actually do their bachelor's for 3 years rather than waiting just to get in the program, right?
Yeah.
Oh my god.
Yeah.
I didn't know that.
Yeah, I was very fortunate. I sat on the wait list for a week. Mind you, I did have to travel an hour and a half for all of my clinicals and my labs and stuff, but
you saved 3 years.
I saved
Or
3
4.
years. Yep. And I saved myself a lot of debt too.
Yes. Oh my god. That's new information.
Yeah, it's certainly a long wait list for especially NSCC.
Mm-hmm.
I know they're seeing it right now where the government's incentivized going and getting your LPN and then working in long-term care and taking that pathway. They're trying to pick away at the wait lists. I know that. It's going to take some time.
Yeah.
But it's good that a healthcare profession has a wait list like that.
So, how are the placements like? Is it equally stressful?
I would honestly say that being on placement as a nursing student was a lot more stressful than showing up to my job every day as an LPN. Mind you, like, yes, there are very stressful things I have to do. I learn something new every single day. But in nursing school, I found it was a group of up to 8 of us.
Mm-hmm.
We're all fighting for skills. If somebody needs an IV put in, one of 8 of us are gonna get it. So it's a matter of getting those skills. That was like the biggest competition there.
The placement, so.
Yeah, and as a student, you're limited to what you can do. Rightfully so. You don't have a license.
Yes.
But it was definitely a good experience. I did find I took more away from like my one-on-one placements with an LPN than I did as a group. But having that group was actually really therapeutic too. Like, you do make friends in school, and it was good to have somebody to like bounce ideas off of, or say, hey, I'm really scared to do this new skill. Like, will you come watch me do it? And be my emotional support person.
Yeah. But is it easy to get placements or internships? Like,
so in Nova Scotia, they place you, like, you don't have to go look for your placements. It's not like like when I took social services, I had to find my own. The PN program, they find it all for you. So basically, from my understanding, what happens is every health profession, like every health student, no matter if you're nursing, dental, diagnostic imaging, you're all put into this one pool. And there's like X amount of placements across the province. And they kind of pick where they're going to put them.
because they need like healthcare workers all the time, so.
Yeah.
That's why.
And it comes down, I know the biggest issue with me being a rural student living in the city was there weren't enough city placements because the rural students weren't prioritized. The city students were.
Okay.
Yeah. So that's why I had to travel.
Okay, that's the thing also.
Yeah.
But it's not bad because I know I had studied like computer systems, so it's basically IT, and colleges don't really, or universities support people. Like, they do get companies, but you will still have to like apply by yourself, and just like the same way you apply for jobs, just apply for the internship, and if you get it, you get it.
Yeah. It's not so much like that in healthcare where they do place you. I mean, at the end of, especially some of the one-on-one placements, sometimes they'll offer you a job depending on where you've done your placement. Some places won't. It depends on the demand of wherever you're at.
That's good that it comes with job security, right?
Oh yeah. I'll never be short a job.
Sorted for life, I guess.
Hopefully.
So, do you think it is worth becoming a nurse in 2026?
Absolutely. Hands down. I have been a nurse for a little under a year now. There are times where I really want to rip my hair out, and some things about our healthcare system drive me a little bit nuts. But at the end of the day, like, I'm trying my best to help somebody, and I know that if I'm the one providing that care, I'm going to try to my best ability to give the best care I possibly can. And although it is a trying profession, it is a chronically understaffed profession, incredibly rewarding. I have no regrets whatsoever.
That's great. And also, like, from salary or pay point of view, it is something people can settle for, right?
Yes, I'm fortunately in a position where, like, I do have a common law partner and we do share the bills, so it makes it a lot easier. I will say, like, as an LPN, I'm not getting paid as much as an RN, which totally makes sense because RNs, they have a more expanded scope of practice. In turn, we are paid our respective wages. And even if I were on my own, I think I'd be doing all right.
Okay.
Yeah.
So, people have the motivation to be a nurse.
Yeah. Yeah.
Okay, yes. What is that one thing you think people should know about Canadian healthcare? I think people know that it's free, but it's not free, right?
I've tried to explain this. I have a friend who lives in the United States, and I've tried to explain this to her in the way of, if you show up at the emergency room, you will get seen. As to when, that depends on how sick you are.
Yeah.
It is just
You
the
may die
Canadian
in 8
triage.
hours.
Yeah, like, you might be sitting there for 8 hours, you might be sitting there for 4. I think what a lot of people don't understand when you show up to an emergency department, when you see the nurse for the first time, the emergency room isn't a first come, first serve. It is whoever is sickest is going to be seen first. And sometimes people get tripped up on that, especially, like, you're going to the emergency room because you're not feeling well. Nobody wants to be sitting in a crowded room full of other sick people feeling like crap. And that's when some people in their minds will go, well, I might as well just be sick at home.
That's true.
We are understaffed. And I don't work in an emergency room. I have, like, work experience in an emergency room, but the Canadian healthcare system is understaffed. And yes, it may be free, and it is great that it's free because there's a lot of countries where
it's very expensive.
It's incredibly expensive. Yeah. It takes some time, especially where we have a lack of primary care. We have a lack of people having family doctors.
Yeah.
Where else are they going to turn besides the emergency room?
Oh, I am still struggling to get a good family doctor. I don't have since I moved from Ontario. Because like, you go to walk-in clinics and they're like, you need to have a family doctor and they can refer, but the waiting list still is like
and I know that
years.
they're trying to make other pathways, like the pharmacist program and then Maple. But at the end of the day, if you really don't know what to do, if you're really feeling unwell, go to the emergency room. If you have to question whether you should be there, you should probably be there.
Yes.
So it is a blessing that we have free healthcare in Canada. There's a lot of people who need free healthcare in Canada.
Yes.
We don't have the supply for the demand.
Yeah. And not everything is free. Like, dental is not covered and it's extremely expensive. Like, for me, if I have to get my root canal and stuff here, I could probably go back home, like, book a ticket and get it fixed and come back.
For the same price you would.
Yes.
You would get it done here, yeah. And I know dental, in some cases, I think it's mostly children. There's some sort of provincial coverage for dental, but as an adult, I'll sit here, I don't like the dentist. The dentist is a scary place.
Yes.
They are incredibly nice people. It's a scary place for me. I'm gonna hold off going to the dentist until as long as humanly possible.
I did that, but then I regretted that because last year around November, October, I went to dentist like 6, 7 times because I had so many cavities. I had to get a root canal and stuff too.
Yeah.
And I hate it.
Yep.
I just can't describe in words like how much I hate it. And the funny thing is, like, when you just lay down on the chair and there's a TV on, like, that didn't help.
It's
That do
not
not help.
I saw a TikTok recently, and there's like this emotional support dog at a dental office. I have no clue where. And he just comes and sits on your lap. Like, if you were offering me puppy therapy, yeah, I'll come to the dentist every day of the week. Do whatever you want. Take all my teeth for all I care. But yeah, no, dental.
No,
isn't
that
really
TV doesn't
covered.
help because now you can only listen to what the equipments they're using, like the drill machine sound. And what's the point of just looking at that?
Like,
TV?
I'm just trying to watch like Judge Judy. Like, come on, I'm here at like 10 a.m. on a Tuesday.
Oh my god, yeah, it's crazy.
Yeah, and then like you said, like it's really poorly covered. I think
Yes.
I have dental insurance through my work, and I went in, gosh, back in the summer, I had to have a cavity filled, I had my checkup, my cleaning, and then I had to get a new retainer. Keep your retainers. Don't lose them. And before my insurance kicked in, I was looking at like $1,600 for all of it. And if I didn't have that insurance, I wouldn't be going to the dentist.
Exactly. I went there because still I had insurance and it was, I think, 80%
Mhm.
covered or something, 75-80%. But still, like, the root canal was around 1,700-1,800 and it was covered, and I had to pay a lot of money, around 500 for that. And then for the cavities, it was like around 100, like 70 to 100 for each visit.
Yeah.
They were filling.
That's not
cavities.
affordable for a lot of people. I think if I were in a position where I had to go to the dentist tomorrow,
Yeah.
I'd be worried about putting groceries in the
And
fridge.
you know what happened with me? So before the root canal, my dentist decided to skip it, and like, not skip it, just give it a try, just with filling.
Yeah.
So he did the filling, and that was covered in my insurance. But then it was not working. I still had the pain and stuff, so I had to go back and get the root canal done. And the insurance did not cover the filling. They were like, "We did it." Like,
We already did that.
yeah.
Like,
So I had to pay extra for that.
yeah, and then you look at prescriptions as well. Like, I have migraines, and I'll pay, I think it's like $13 for every prescription that I have, which isn't a bad copay. It's really not. But my migraine medication alone, a box of 10, is $300.
That's expensive.
So if I were without insurance, I get enough migraines that I'm going through a box a month.
No,
$300 a month.
that's too expensive.
No, can't do it.
Yes. Oh my god. Yeah, let's see how it goes.
Yeah.
I hope we get better with healthcare, like better with time.
Yeah, I think the insurance companies, it's a lot of legislation. It's a lot of just going back and forth between the government and these companies. Something's got to give, because healthcare needs to be affordable. If we're going to be providing free healthcare, let's
do
make
it
something affordable
actually
across
free.
the board.
Yes,
Yeah.
yes. Because a lot of people, they are not interested in getting company insurance. Because I have friends, they are like, we don't want this $30 off our every paycheck. Like,
No.
we need the money kind of stuff. So
Exactly. And then you don't need it until you need it.
need it.
You know what?
Yes.
Oh.
Yeah. Well, let's hope for the best.
Yes.
So I think, since you have experience as a frontline worker at a shelter and like at a hospital, I think we should compare both the situations. So I have a few questions for that.
Okay.
So which job is emotionally harder, like being physically available at a hospital or being like traumatized by few stories at the shelters? I would say, which is harder for you?
I think when I first entered shelter work, I would have been 21, and I kind of had that mentality of, I'm going to save the world. Quickly went away. A win is a win, even if it's a small win.
Yeah.
But, like, hearing people's stories, yes, it's incredibly traumatic. And seeing some of the situations that, like, clients that I've interacted with are currently in, especially I find, like, people who are in conflict with the law and, like, being institutionalized and, like, having mental health concerns that aren't being addressed, it is incredibly traumatizing. I have seen some very traumatizing things in shelter work. I think it's a lot more talked about because in healthcare, the unfortunate reality is I'm going to see people who are in the worst state they've ever been in.
Yeah.
I'm going to see people die. It seems a lot more normalized in, like, a healthcare environment that we're going to see these things.
Like, people are mentally prepared, so...
Yeah, I find there's less of, like, shock value to it. That's not to say that shelter work isn't traumatizing, because it certainly is. I find hearing it and seeing it are two different things. I can almost, like,
Yeah.
I can still hold that empathy in that space for somebody who's coming to me saying, hey, I experienced this really traumatic event.
Yeah.
But then to see somebody else's traumatic event play out in real time, it's harder to compartmentalize that. Like,
Yeah.
the first time I did CPR on somebody in the hospital environment, it took me a second to bounce back from that because I was like, this is real. Like, what I just did is incredibly real. It's incredibly raw and vulnerable and sad. But it's something that happens in healthcare facilities all around the world every day. So it's kind of, you inherently compartmentalize it.
That's right. Yeah.
In shelter work, it's more of a, hey, this happened to me, I need to talk about it, I need to process it.
Yeah.
It's like having one foot out the door at all
Exactly.
times. Yeah.
Yeah. That makes sense.
Yeah.
Do you think, like, healthcare and social support system communicate enough with each other? Because
It's hard for me to comment on this because I'm a night shift worker. I'm not like, yes, I can send a consult for social work. Absolutely, I can. I can look at the social determinants of health and say, hey, like, this person's in the hospital, like, they're losing their wages. We need to consult social work for EI, childcare, stuff like that. But I think there certainly is a gap when it comes from, like, a shelter point of view, especially. You have people who maybe don't want to access the healthcare system because it's traumatized them in the past. Or you have somebody who doesn't have a family doctor, doesn't have a health card. Those barriers exist everywhere, and we see it in our community.
Even, like, people are afraid to lose their beds if they go to hospital.
That is something that I have seen before, and it felt like my hands were tied. Like, having somebody who was unwell enough to be admitted to the hospital saying, hey, when I get out of here, like, I have nowhere to go, and the best thing I can do for them is hand them a phone number for a local shelter. It's like, what else can I do? And it is really sad, and it is a frustrating part of my job that, like, I can't really combine the two, because in healthcare it's like, I'm a nurse. Yes, I have access to all of these tools, but I'm not the expert in it. Somebody with a social work background certainly is going to be the expert on it.
So there still are, like, loopholes, but there is communication, but it needs to get better, right?
Yeah, and I think it's the whole system. We have people who fall through the cracks, whether it be healthcare, income support, anything like that. We're still seeing those people fall through the cracks. That demographic that really needs that social service support.
Okay, so let's move on to a little fun segment.
Okay.
Like not fun segment, but small little
Okay,
funny
I
questions.
love it.
Okay. So, if you weren't a nurse, what random job would you pick for yourself?
I would be the person that holds the cones and marshals airplanes in at the airport. Honest to God.
I can imagine. Oh, okay. Oh, I never like thought you'll answer that job.
Surprise!
That was a surprise.
I like planes. Seems interesting.
I assume maybe you'll run a bakery or something.
Nope. I want to hold the cones. Just, yep. I think it would be fun.
Okay.
Good time.
If you get a chance to change one policy, like tomorrow, what would that be?
Oh. Honestly, I know that healthcare is supposed to be equal and equitable. Women's health, like, I feel like women's health needs to be backed by more female-driven research, and that's not so much a policy, but if I won the lottery tomorrow, I'd put money into women researching women's health.
Okay, that's a good cause. But do you buy lotteries and stuff?
No.
Then you should start.
I might. I'm feeling lucky today. I might have to hit up the gas station on my way home.
Do it. Okay, so although I know we have talked about it earlier, so what was your like? This feels like a horror movie scene at your work, like. You might have a lot since you work night shifts at hospital, but
I mean, I see some pretty gruesome things. I see some pretty gross things.
like scary things.
Scary. I once saw an individual who had broken both of the bones in their shin, and both of those bones came right out through their skin. So the bottom of their leg was just kind of, yeah, it looked incredibly painful. Yeah, that was a pretty bad one. But from my knowledge, they ended up okay.
That's good to know.
Yeah.
And like anything, horror experience, like creepy experience you had at your shift?
I'm a night shift worker in a hospital.
Yes.
Okay, first of all, I do believe in ghosts. I
know
know they're
that.
there. I know they're there.
Yes.
I can't say there have been any like paranormal stuff.
Mm-hmm.
The hospital is home to a lot of mice, and they really like jump scaring. They are very friendly little creatures. There have been times where I've walked into the supply room at 2:00 in the morning and a mouse comes running in front of me, and I have almost peed myself multiple times because of that.
Yeah.
I think that, like,
I get scared easily.
there's some, like, I'm there for some people's scariest days of their lives,
Yeah.
and I'm scared too 3/4 of the time. But the mice, no. Something about a mouse at 2:00 in the morning just scurrying along, creepy.
Even during the day, if I see a mouse everywhere, like anywhere, I get scared. Like,
Yeah.
I generally am scared from the mice. But I remember, like, one time you were telling me something about your shift, like night shift at hospital, where you went in the basement and there was like a security guard or something. I don't remember.
The basement is a creepy place. So every 3 months, I have to renew my CPR. And the, like, mannequin is down in the basement.
Okay,
In one of, like, the
okay.
education rooms. And I have to ask security to open the door for me. Something about being in an empty room with a mannequin doing CPR at 4:00 in the morning, it's creepy. It's really, really creepy. It's cold down there. It's dark. It's overall just, like, not good vibes.
Yeah.
But I have no choice. Because it's my job.
Okay.
So I have to suck it up and go down and do CPR on the creepy mannequin in the creepy basement.
Oh my God. Yeah, I can understand that. There was like a time when I even was scared to go out at night for my shift, because I also work night shifts, and when I leave it's so dark,
Mm-hmm.
and there was a lady in like apartment just next door, and she was like a really old lady, but she died last year, I think, in March. And Cody, so I told this story to Cody, and Cody was like, she probably is around like in your backyard somewhere, because people who are old and who have lived in the same apartment their whole life would still house. Yes. And that thing like that scared me, and since then I just like believe that she must be like watching her somewhere like outside the house.
Oh yeah.
And I was scared for months, but now I'm okay and I don't care anymore. But
yeah, I try not to like think too much about it, because like a hospital is a place where unfortunately not everybody gets better and some people do die. There's gonna be some sort of entities walking among us, and if they're peaceful, great, cool.
Great.
You can hang. Sounds so good. Come eat chips and gossip at the nursing station.
Yeah.
Otherwise, kind of creeped out by it.
Yes.
But I've never had anything like truly paranormal. Like I've never had any sort of experience in a hospital environment like that.
Okay, but I think that's good. I hope you don't get one in the future, because it's not good.
Knock on wood.
Okay, so tell us about any funny thing that a patient has said, like ever said to you.
I get insulted a lot.
How come?
Sometimes when people may not have their wits about them, or they have dementia, Alzheimer's, sometimes the part of their brain that has that impulse control, and like, you know how we can keep our inside thoughts in? Some people who have neurological disorders can't do that. So sometimes I get insulted, and you gotta take it with a grain of salt. I remember when I first started in frontline work, people would insult me and I'd be like, oh my god, this is the end of the world, I might as well quit my job, I'm horrible. But now if I'm insulted, I'm like, okay, not a reflection on me. Hurt people hurt people.
Yes.
So I can't really divulge into what they've said to me, but some of them I'll hold on to forever, just like some of the good things. Some of the insults, like, they get right creative. Like, okay, I will add that to my list. That's great.
Yeah. Okay, I can understand that. So the one question I had was day or night shift, but you already said that you work night shift.
Only work night shift. I had to get up last week for a training in Halifax, and I had to be there for 8 a.m. and my friend picked me up at the bridge terminal, and the first thing she said to me was, "You look like crap." This is my bedtime. It is 7 in the morning. It is time for me to go to bed.
Yeah. Yeah, since I've met you, that time also you were working nights, right?
Yeah, I never thought I'd be a night shift person, but being awake at 8 a.m. is just, like, that's not appealing to me.
Yeah. I also like afternoon shifts a lot better than night or day
I don't mind an afternoon.
Yeah.
But night shift, I don't know what it is. It's just time that my brain feels awake.
Yeah. I like night shifts, but only 8 hours. I cannot do 12 hours night shift.
12-hour night shifts, sometimes they drag, sometimes they go by in a blink of an eye. But it can be hard to be away from home, especially in the middle of the night, for 12 hours.
Yeah. I'm afraid, like, if I take a break and take a nap in the break, I will never get up and complete the rest of my shift.
That's why I don't nap on my night shifts. I will sooner, I don't drink coffee that often. I will sooner, chug a coffee than take a nap. Because once I'm asleep, there is no waking me up.
Exactly.
Yeah.
Okay. So, what is your comfort meal after a shift?
My mom makes this pasta, and it's so basic. It's ham, peas, Parmesan cheese, and parsley with like the rotini noodles. That with some butter.
You like that?
Go-to comfort meal. She makes it for me every year on my birthday. That's all I want.
And I know your comfort drink is Diet Coke. I bought you one.
Oh, you stop it.
No,
You never do that. I'll accept it though. I love Diet Coke.
Yes, I know. I watch a lot of your Instagram stories on Diet Coke especially.
I bring 2 Diet Cokes to work with me every night. And if I forget my Diet Coke, I'm at McDonald's on my break getting a Diet Coke.
So I was like, okay, I have to get it.
Thank you. I appreciate it. I don't drink coffee, so that's like my source of caffeine. Sometimes I go a little overboard, but it's alright.
But it's diet, so.
It's diet. There's no calories.
Yeah. Okay, so we're almost at the end. So I would ask you, like, would you recommend any of the career, like, related to frontline to someone?
Absolutely. It's incredibly rewarding, and it feels good, like, seeing people even make, like, a small stride towards getting better.
Yeah.
I did find, like, in shelter work, not everybody's going to get better, and it's similar to, like, healthcare in the hospital. Not everybody's going to get better, but it's those, like, small wins that make the job worth it. Like, I'm not going to see every patient that I've ever had make a full recovery and walk out of the hospital, but, like, maybe one day they ate 25% of their supper. Today they ate 75. A win is a win.
Yes.
And I think it's, like, the small wins that do make frontline work absolutely worth it.
Okay. Yeah. I want to ask you about the immigration thing also. Like, as a Canadian, how do you see increasing immigrants in this country?
I don't see as much in the hospital from, like, a patient care standpoint. I think we are certainly seeing more of it perhaps in, like, the children's sector. Like, people coming to Canada and they're starting their families in Canada. There's certainly a lot more people who come from different countries that are working within our healthcare system, and I think that they all bring very, like, unique backgrounds, and they bring a different perspective to such a, like, a Western profession especially. And I think it's great. I love having other perspectives. I like hearing other people's stories, and I mean, Canada is such a, like, multicultural place. It's good to have those stories, and it's good to have that diversity in healthcare in, like, every sector really. But it's good to have, like, representation that isn't predominantly Caucasian.
Okay, I really appreciate that answer. Okay, so that was everything. I haven't prepared any more questions. Maybe if I get...
I have a question for you.
Okay.
I'm
nervous.
As a frontline worker, I know that you work, like, not only where we work, but you work other places. What is something that you wish, like, healthcare workers knew? And maybe not necessarily, like, just nursing. What do you wish healthcare workers knew about the populations that access social services, addiction support, mental health support?
Honestly, for the documentation perspective also, I don't know what documents or, like, you have at the hospital, like, what documents can you access about a patient. But if somebody went to hospital from a shelter, it's good, like, if doctors and nurses are aware of their past. I believe they must be, like, that's what we believe, but sometimes, like, they're not, especially about their traumas. And we get a lot of residents who complain that these people does that and I don't really like this and kind of stuff. So like, knowing the history about a resident or a client,
and then, like, taking that, like, trauma informed lens.
And I think it comes back again to that loophole of communication between the social support and the healthcare support.
Yeah. And I mean, in Canada, anywhere really, like, people who access care, like, they don't necessarily have to disclose, like, if you use drugs.
Yeah.
Like, that is one of the questions that is asked on admission to a healthcare facility is, do you have any alcohol, marijuana, or other drug use? You are at liberty to not disclose.
Mm-hmm.
I've said it before, and I will say it again throughout my career. I am a nurse, not a narc. I am not going to sit there and judge you for what you use, don't use, any of the above. I just want to be able to provide that best care possible for you. And I think that's something that, like, people have a lot of embarrassment and shame about their use.
Yeah.
If you don't want to disclose, that's fine. I'm never going to, like, pry at you for that information. It's just, how can we best help you with the information that we have? And, like, yes, I think we need to see a lot more, like, trauma-informed care within the healthcare system. We see a lot of discrimination and prejudice against people who may be using substances or have had any sort of trauma. It's going to take some time. And, like, because it's not happening overnight, it's really taking, like, a hit to that population, whether or not they access care. And then when they do access care, they're usually quite sick.
That's one thing. And I also feel like sometimes, assume if a resident from a shelter is at a hospital and, like, for a day or two, and then you try to get to the nurse to get all the details, like how's the treatment going or what is happening. It's so hard. Like, they will put you on hold for, like, so long, and they'll just keep switching the numbers and tell you to wait for, like, a day or two sometimes.
Yeah.
And again, it's just the loophole thing, but residents have to suffer because of that, right?
Exactly. And, like,
because if we don't get any update from hospital, the bed is not secured.
Exactly, yeah. And, like, sometimes people who are, like, accessing housing in these shelters, the only next of kin they have listed is somebody who works at the shelter. Yeah. And we see those barriers where it's like, well, you're not the staff who called yesterday.
Yes.
Can't help you here.
Yeah.
Other times, like, when the phone line is just on hold and on hold and on hold, we are incredibly busy and we want to get to that phone call. We want to have those conversations. Mm-hmm. But, like, the main focus would be, let's get this person what they need first and then update
the
later.
And stuff. Yeah.
But 1,000%, I think there needs to be more communication, especially when, like, healthcare providers know that this person is coming from a shelter. Yeah. I don't think it's a lack of understanding, but every shelter operates differently. But there is always that, that person likely doesn't have a bed if they can't provide their whereabouts or have somebody to advocate for them and vouch for them.
Yes, that's absolutely. And I think that happens because healthcare being understaffed too, right?
Yeah.
But there are slow and steady improvements. So
we're getting there. We are getting there. It'll never be perfect. Working with humans is never, ever perfect. That is one thing I learned really quickly, like, especially in the shelters. Some people, they don't want to have that, like, therapy speak. They just want you to be, like, 1,000% real with them. And sometimes, like, I carry that with me, and I'm like, I'm not going to give you the whole spiel. I'm just going to give it to you the way that your brain is going to process it. And it's effective, and sometimes it really does build that rapport, but everybody's different. We're never going to see a perfect system because everybody's different. That's my opinion.
Yes. Oh my god, it was such a good conversation.
Yes!
I love it.
Oh, I love this. I could do this forever. I love yapping.
I know. Yeah. I think we'll do a fun yapping session too.
Absolutely.
Later someday. And
love a good yap sesh.
yes.
So good.
But it was so good, and thanks for being like open and sharing a lot of things.
Oh, you're very welcome. I appreciate you having me. This was awesome. This is my like first podcast experience. I'm like, okay, this is awesome.
Good to hear you like it.
I love it.
So yeah, that's everything. Thanks
Cool.
for joining me.
Thank you.
And if you want to say anything to the audience, you good to do that. Brush
Your teeth. Take care of your body. You only have one. If you're having some trouble caring for your body, that's where the nurses come in. We're pretty cool. Pretty cool bunch of people. Yeah. Live healthy and stay cool and drink some Diet Coke. There we go.
Awesome. Awesome. Okay, so I'll see you next time. And
Absolutely.
we'll surely have a part 2 of this.
For sure.
Part 2.
Oh my god, I
Yes.
can't wait. I'm so excited.
Yes. Okay. See you.
Bye.
Bye. I've actually.